Remember I talked about yesterday about getting to the next level, thinking clinically, and this is all part of it, is where we take what we know, but we apply it with concepts that we also know in terms of neurology, in terms of, like I talked about yesterday, when to apply a peripheral treatment, which a motor point is, or a central nervous system treatment. We talked about when to use motor points and when not to use motor points. And we said that if the patient has a systemic problem or is a chronic problem, specifically chronic pain or systemically like rheumatoid arthritis, that the reason why we have to decipher is it a mechanical treatment or is it a non-mechanical treatment is because adding a mechanical treatment to a systemic or a chronic pain problem it can hurt the whole treatment process for two reasons. One, I said we could flare the patient up. That's possible. But let's say you don't flare the patient up. Let's say it doesn't flare the patient up. The problem you have is number two, because every time we treat a patient, we need a game plan. That's why we assess, right? So we know this is what's going on. This is what we need to do to get them better. So by using a motor point on a chronic or systemic condition, we're using a peripheral input to try to normalize a problem of the central nervous system. And that doesn't work that way. So if you do get any results by applying, let's say, a motor point to a systemic problem, the results will be short-lived because someone in chronic pain, remember the two things of the three things that cause motor inhibition, pain, and someone in chronic pain is in pain all the time. Someone with a systemic problem like rheumatoid arthritis has joint problems everywhere, and changes in the joint also cause motor inhibition. So you're left with the dilemma that even if you treat the motor points on someone with a systemic problem, that because they have pain all the time, it's going to become inhibited the day after. But that's even the beginning of your problems. The problem is, what do? You just start doing the motor points on one shoulder, and then do the hip, and then do the other hip, and then do the other shoulder, and then do the back, and then do the front? That's not a clinically efficient approach to doing anything. But what is recognizing when we need to neuromodulate the central nervous system and doing so, which wouldn't be motor points. It would be things like a perfusion treatment, micro points, distal points, and then things that aren't even acupuncture, like yoga, meditation, transcutaneous, transcranial microcurrent stimulation, stuff like that. And of course, as practitioners, although there was a great quote, I remember one of my teachers in chiropractic school would say, when all you have is a hammer, everything begins to look like a nail.